Okay, so this is my verbal video for the enema. So I chose to do a soap sed enema. So the first thing that you want to do is check the provider's order because the provider will order how much water soap to give the patient. So you check the provider's order and then you'll grab your bag, your warm water, as well as the soap. Go ahead and mix the correct water in with the correct amount of soap inside the bag. You can check the temperature of the bag by just touching it or even putting a thermometer in it if you'd like. And then you go ahead and walk into the patient's room. You're going to provide patient privacy, advise them that you're the nurse and that you're going to be providing them an enema today, and then do 2 patient identifiers. So get their name and date of birth verbally as well as checking their wristband. And then you want to go ahead and perform your hand hygiene and glove up. You can also wear a gown in case there's any leakage or anything like that, splatter from the enema. But then you'll want to position the patient in the right position. So you're going to have them roll onto their left side and bend their knees. This helps the flow of the enema, and then you will go ahead and uncap your tube, and you want to lube that up. You can go ahead and place the enema bag on the IV pole, and then you want to inspect the rectum. So you're looking for hemorrhoids or any bleeding because you don't want to insert the tube if there's hemorrhoids or bleeding. And then you will go ahead and insert the tube after it's lubed up and uncapped. You'll insert the tube into the rectum about 3 to 4 inches. Again, if the patient feels any pain, go ahead and remove it. If they'll let you try it again, go ahead and try it again. After it's in, you want to grab the bag down from the IV pole, and you want to have it about 12 to 18 inches away from the patient's rectum. And then you'll unclamp the tubing so that the fluid can flow in. If the patient experiences a lot of pressure or any cramping, you'll go ahead and clamp that enema tube and clamp it for about 30 seconds. And then after 30 seconds, you'll unclamp it and you'll let the flow go again, but pretty slow this time. Once all of the fluid is gone, you will go ahead and take the tube out. You're going to go ahead and clean the patient up and then cover them back up. You'll get rid of your supplies and throw them away. Take your gloves off, perform hand hygiene. And then you want to advise your patient that they need to keep that fluid inside of them for at least 5 to 10 minutes. Of course, if they have to go to the bathroom before that, go ahead and get them to the bathroom and provide them a pan. But you want to have them to try to keep it in for at least 5 to 10 minutes for it to break down that stool, and just let them know that they might feel a lot of pressure from the fluids being inside them. And then after they do use the restroom, go ahead and evaluate the stool. You are looking to make sure if the enema was successful or not, and check to see the stool's consistency because they might need another enema as well.